Hello, I'm Dr. Andrew Frankel. I'm a facial plastic surgeon at the Lasky Clinic in Beverly Hills, where I've been in practice for 26 years. You are listening to Interview with a Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Andrew Frankel, a world-renowned facial plastic surgeon who has maintained a thriving boutique practice in Beverly Hills for over 25 years, working exclusively within the face and neck. As a specialist, Dr. Frankel is experienced and comfortable performing all types of facial surgeries and procedures to address his patients' needs. Dr. Frankel is a fellow of the American College of Surgeons and is an active member of the American Academy of Facial Plastic and Reconstructive Surgery and the American Academy of Otolaryngology Head and Neck Surgery. Dr. Frankel has served as an assistant professor on the clinical faculty at the University of California, Los Angeles, as well as the University of Southern California Keck School of Medicine, and remains active in academia by publishing, lecturing, and performing clinical research.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Andrew Frankel, facial plastic surgeon in Beverly Hills. Doc, how are we doing today?
Great, Matthew. Thank you.
It's a real pleasure. Thank you for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change throughout your fellowship?
I think, like many residents, my main focus at that time was to learn my craft. You fall into a comfort zone with respect to your future when you're in your training because you're taken care of by the institution where you're training. And so there's so much to learn, and there's high stakes, of course, when you're taking care of patients, but that's where the focus was. And I think I always just assumed that along the way I would figure out my future. And when those decisions arose, I would deal with them at that time. So to be quite frank with you, I did not give much thought when I was in my training to exactly where I was going to take my skills. I think that I'm in a unique perspective now because I'm a fellowship director. And for the past 13 years, I've been able to mentor very qualified young doctors as they transition from their training into the real world, whether that's an academic career or a private career. And when I watch them go through that process, I can think back to my own life and how unprepared I was really to move forward. So to answer your question more specifically, I don't think I really thought too much about my goals at that moment, except getting through the next month, each month at a time.
So kind of taking us through that fellowship year, what was your mentality heading into your first job search, and how that perspective changed in the beginning years of your career?
I'm from Chicago, and I was very grateful to be able to come out to Los Angeles and have a fellowship with a very well-known facial plastic surgeon named Frankel. At the time, I came out with the intent of returning to Chicago and probably practicing general otolaryngology with facial plastic surgery emphasis. And within the year, I continued to just learn my craft and did not even give much thought, even during my fellowship year, to what I would do at the end of that year. Probably about 6 months into the fellowship, with only 6 months remaining, it dawned on me that I needed to start making some decisions about my future. And my initial play was to return to Chicago. So I reached out to some people who I thought highly of. And sure enough, I was given a couple of opportunities to join them in practice, as they were excited to have me return with my newfound skills and the cachet of having worked in Beverly Hills back to Chicago. So I began the process with them, but all the while wasn't 100% set on it. And what occurred was that that process of actually digging in the details with those job opportunities revealed that there were some problems with them, and none of those were very much going to be in my favor. I was going to be exploited. So as the process went on, I started looking around more holistically at my life and what I wanted. And ultimately, an opportunity came up that I could stay where I was with my mentor in my practice in Beverly Hills and just begin from scratch. And I thought I would take advantage of that. There were a few things that worked to my advantage. Number one, I wasn't married. I did not have any children. I didn't have any dependent family members I needed to take care of. And so I was very fortunate in that I could have the freedom and flexibility to take advantage of any opportunity that I wanted to. And that's precisely what I did. And it wound up being a very worthwhile move for me, and one in the long run that's worked out tremendously.
Taking us through that career journey, did you ever consider going academic, or were you private practice focused all the way?
Like many of the fellows who come to me each year, I wanted to remain attached academically as well as to have a private practice. I have more of an entrepreneurial spirit, and I also have a bit of an issue with big bureaucracies and institutional rules and regulations. I'm really not a rule guy, except how they apply to everyone else in the world. So I wanted a little bit of both. And I think it's very common when young doctors coming out of their training to be comfortable with an academic environment, because that's all they've known throughout their entire life. And that comfort level is something that no one wants to completely unhitch from. I maintained both coming out of my fellowship. During the fellowship itself, I became very involved at UCLA and at the West Los Angeles VA Medical Center, where I was teaching the residents facial plastic and reconstructive surgery. And so when I transitioned out of my fellowship into private practice, I maintained my tight relationship with UCLA and ended up teaching there for 11 years at the VA hospital. And looking back on it, that is some of the most rewarding stuff I've done in my career. But I wouldn't have been happy being solely an academician and working in an institution like that. I needed to get out and do my own thing. And so I feel, again, very grateful that I was able to actually engage both parts of my desire, in both private entrepreneurial things as well as an academic thing. And to date, I've never really had to give that up. I taught at USC for 10 years, and I have had a fellowship for 13 years where I feel like I'm giving back and I'm staying connected to the academic world by having these incredibly bright fellows every year who just came out of residency. And they certainly know much more about the current state of medical care than I do. And that makes me feel more involved and more knowledgeable. If I were to have remained solely in private practice, then the problem would be that you become speciated like the Galapagos Island. Eventually, you're doing your thing every day in your private world and you disconnect from your colleagues and the hospitals where the changes and technological advancements are taking place. And before you know it, you're practicing medicine that's no longer current. And I think that's been the beauty of having the fellowship and the academic attachments.
What would you say were some of the keys to your success that shaped your early career as you climb to the top of your industry?
Well, I would say that for me, as I've already alluded to, one of the keys was just being flexible and independent enough that I could focus solely on my career. I would encourage people who are very passionate about their career to hold off on making big life decisions so that they can give of themselves to their career without restraints. I have known many, many talented surgeons and very bright people who've ended up being stymied slightly in their own personal development because of some personal choices or constraints that occurred not to their fault. I was just lucky not to have any of that happen to me. The other thing I would say that was helpful is I stayed completely focused on my business and my career. Every single day, weekend, holiday, day in and day out, I was thinking about and working toward building my business. I never, I tell my children that if you love what you do, you never feel like you're working, and if you love what you do, you never work a day in your life. And that's how I felt about my practice. And that's the beauty of being a private practitioner. It is like your child, it's your passion. And everything you're doing brings you a sense of joy and purpose. And therefore, it doesn't bother me to expend energy towards it because it's purely for my own advancement and my own happiness. So one thing I would say that was helpful to me was not having been tethered to other responsibilities. Another was to make connections with bright people. I was also fortunate to grow up in a community where many of my friends ended up being extremely successful in their various fields in life. And when life hits you after your training, there are some very big decisions that need to be made right off the bat. And I went to the very most qualified people I could find in my life, spent the money, and made the due diligence happen to make the right decisions to set me up appropriately at the beginning. I have many friends who want to cut corners and not spend money right out of the bat because they don't have a lot of money and because they don't see the value in using a better attorney or a better real estate broker. And they end up shooting themselves in the toes by saving a few $1,000s and ultimately having poor contracts and making poor negotiations and putting themselves at a disadvantage for future things. So that's something that also was very helpful to me.
Seeing that you've dealt with residents and fellows, what advice do you have for them when they're graduating and entering the professional job market for the first time?
So the first piece of advice I have for my fellows every year is that they should go to the location, the city, the region where they want to live. If they have a particular desire to live in a specific place, they should not get there in a roundabout fashion. They should go immediately and start building goodwill and building the reputation within that community. If someone just wants to hang out in LA for a few years because it's fun and then ultimately wind up back in Cleveland, what they're going to end up doing is building all this goodwill for 4 or 5 years in LA. And then when they leave, they start out with nothing again in Cleveland. And that's unfortunate because there's a lot of compounded value to staying in one place and developing your relationships, your connections, and your goodwill with your patients. There's really nothing more valuable as a surgeon, as a physician, than happy patients and relationships for people that you take care of over the long run. And each worthwhile experience with a patient usually ends up bringing you more patients. And you want to build on that from the get-go. So that's the number one thing, is to go where you want to live to begin with. Number two would be, do not skimp on getting good legal advice and good advice from very respected people in their fields when you're making a decision. That could be an interior decorator with your office space. It could be a realtor for finding the proper place to open a practice. It could be advice from an attorney on negotiating a deal with your soon-to-be mentor or group. Whatever it is, it's worth it to spend the extra money if you're with the right people. That advice is invaluable. The next thing is something I would tell them that I didn't really understand myself, is that it gets extremely busy as a physician, surgeon, and you really want to put systems in place with your practice right off the bat that are thought out for the future, so that when data begins being entered at the beginning, it's going to last you for 20, 30 years in its form. If you start loading photographs up just randomly to your computer, and before you know it, you have thousands of photographs in a nondescript, non-database, and later you're going to have to spend all kinds of time and have all kinds of complications shifting a database over to a better format. The same goes for the software you use in your computer system, and your scheduling, and how you want to brand yourself. Everything down to the stationery you use. It all should be thought out in the beginning, with the idea that that's going to take you forever through your practice. Of course, things are going to change, but you just don't want to jerry-rig the system and build it all fragilely at the beginning, because later you're going to be stuck with a great headache trying to transition things to a new and improved format. Continue to learn your craft. It's extremely important that you do stay relevant and you stay up on the current advances in your field. It's very easy to get stuck in your ways of doing things and what's comfortable. And if you don't expand and stay current, you'll find yourself quickly outdated. Not only is that important for treating patients and providing them the best possible results, but in the world we're currently in, marketing and having talking points is very important. And if you have nothing new to add and you're not up on the latest, greatest things, whether or not you're a proponent of them, you want to have the ability to comment on them. If you don't have any knowledge about what's going on in the here and now, you're going to look antiquated and irrelevant. And most importantly, your patients are your greatest assets. So it is important that you treat each patient with the utmost respect and information, and give them the greatest experience you can. You won't always do well by them in terms of their outcomes. There will be complications. There will be slip-ups from your office. But if you have an open relationship with your patients and they feel like you're doing all you can on their behalf, then they'll be advocates for you. And their advocacy is the most direct effect you can do on your business. These are a group of people who already are within your system, who already know you, and they have voices, and they have friends, and they have colleagues and acquaintances that they can refer you to. And as the world moves forward with social media, there are so many avenues for people to find doctors that I believe ultimately it's going to go back to the good old-fashioned thing where a person asks their friend, you know, I really like your nose. Can you tell me who did that for you? Or who have you heard about is the best surgeon out there for doing a facelift? And word of mouth, patient experience is always going to be the best form of marketing. So it's important that you don't just take a patient in and think of them as a statistic, but that you actually care for them and follow them through to fruition and render the best possible example of your work that you can. As my mentor told me, if you take care of 100 patients, 10 of them will look pretty good, and you'll get busy from those 10 patients. You're not going to hit home runs all the time, or even singles. So you do want to make the best experience possible for each individual person.
You kind of touched on some aspects of part of building a business. And I think if we can kind of touch on that a little bit more and explore what are some of the things, let's say go on the call, first years 1, 2, and 3 in a private practice, what did you learn either through your mentor or learn through mistakes as you carried on throughout your career?
Well, early in my career, I was very interested in treating anyone who would come to see me for anything, because I was hungry for money to keep my business going, and very interested in having another patient that I could check off as being taken care of by me. Unfortunately, that meant I was taking patients in who were not necessarily the greatest candidates, or not necessarily the most exemplary people. And in hindsight, it would be best to avoid patients who are going to be potential problems. Avoid businessmen who might get you into a problem with a scheme. Being extremely cautious is what I would recommend to the young people starting out in terms of how they spend their dollars and allocate their business expense dollars, because there are piranhas out there who want to take advantage of people And I think it's well expected that young doctors and surgeons in particular with egos coming out of their training think much more of themselves than they actually know and their targets. And so one thing I learned after a few years was to be careful in who I dealt with, and to be careful in who I operated on and who I took in as a patient. You'll never regret the patient that you don't take care of, but you do regret some of the ones that you did take care of that end up going south. I still wrestle with this at this point in my career, but it's certainly more difficult to say no to someone when you're young and out of the box, and you want to take care of everyone and you want to people please. And I would advise the young starting physicians and surgeons to be wary, to pay attention to the subtext when they're dealing with a person. And that goes from physical, nonverbal cues to how they're treating your office staff, to how they may berate prior doctors or other people in their life. If you get the hair on the neck, the back of your neck to stand up, you want to avoid those things. And a young surgeon who has less goodwill established in a community can much less withstand having an unhappy patient who will go online and tear them apart. You know, I have years and years and thousands of happy customers and a reputation that's not necessarily going to be brought down or even damaged by one individual patient. But 1 year into practice, you don't have as much. And so these experiences can really take you down.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.